any kind of surgery. So I think that's another procedure that healthcare providers can be aware of.
Thank you. Can you tell me a bit more about the psychosocial therapy and the the possible improvements that women, or the problems that are addressed with the therapy, and what improvements women might see with the therapy?
So having done a screening of the biological issues, and then you find that the woman has probably more psychological or sexual issues. Some of the things that therapy can work is, for instance, even discussing about provision of that kind of education. If you think about a woman that presents into the clinic, I can use an example of what I normally come across. If a woman is complaining of low sexual desire, or is complaining of painful sex, or is complaining of a lack of orgasm, a lot of these kinds of problems can be alleviated by sexuality education about the anatomy and the physiology of the sexual organs, about sexual communication between spouses, so that they can speak openly about these things. So you find when a couple is already able to speak about these things, it helps in changing their attitudes, and probably even creating a kind of a good relationship whereby she will be able to change. Her sexual health care will improve just from simple education and communication. Or so these kinds of therapies, or even reading about different kinds of situations, like, for instance, if even when a woman knows about the kinds of statistics that exist in terms of what is the statistic of women that have problems with their sexual desire, for instance, then this woman will not feel very stigmatized and alone, because she knows that there are many women who are undergoing the same problem and she's not alone. So this sort of normalizes the problem. And then, of course, we have some kind of relaxation exercises which a couple can practice. And this is just going to improve their sexual health with simple kinds of interventions.
Okay, thank you. Thank you for telling me more about that practice. Now I have some questions about how a healthcare provider might respond based on some patient requests. So if a woman requests re-infibulation, what should the healthcare provider tell her? How should the healthcare provider respond?
I think the healthcare provider should respond by asking her to explain the reasons why she feels that she requires a re-infibulation. And then I expect that the healthcare provider will also do a physical examination to ensure or to see what type of FGM she's undergone, and is re-infibulation necessary.
Okay. And what about if a family requests a healthcare provider to perform FGM on a daughter?
Oh, sorry. Actually, I think I've confused with de-infibulation.
Oh, okay. Yeah, re-infibulation.
Oh,
no, it's okay.
So if a woman requests for re-infibulation, okay, yeah. So the healthcare provider needs to explain the type and why they will not be able to do a re-infibulation, because of course it's against the law, and it will continue to perpetuate the health problems that this woman has experienced. And of course, a re-infibulation also is a kind of surgical procedure. So again, it would have its own complications. So I think the healthcare provider should just be clear that they cannot do a re-infibulation, even if requested. Yeah.
Okay.
Or it's against their ethical values, of do no harm.
Yeah, okay.
Yeah.
Thank you. And anything else that a healthcare provider should say if a family requests FGM for the daughter?
Yeah, I think it's important for a healthcare provider to be aware about the laws or policies in their countries. And for instance, in Kenya, because we have a law against FGM, then it will be very easy to say that they will be contravening and going against the law, and they will not risk losing their medical license or going to jail for that.
Okay.
Yeah.
Okay. And are there any other ways, besides what we've already talked about, that a healthcare provider can contribute to the prevention or abandonment of FGM?
Besides what we've spoken about, I think just being champions for prevention. So speaking against FGM, doing community visits and speaking about it, being part of, a group of community leaders that speak about FGM, and then, of course, healthcare providers provide a very strong basis against, so they can give very good points that community leaders will accept easily when a doctor speaks, because they are looked up to like an authority figure in the community. So just being who they are, I think they can contribute to prevention.
Thank you. And then are there any other, anything else you'd like to add about the healthcare provider clinical practice caring for women and girls with FGM?
I don't think there's anything else I should add other than what we've already spoken about.
Okay.
Just being more attentive to these women and girls, especially if they're working in areas where they get confronted by women who've undergone FGM. Yeah.
Okay, thank you. And then the last section of questions are a bit more about attitudes. So first I want to ask some more questions about your individual experience. Can you tell me about some past experiences taking care of women who have FGM in your clinical practice?
A lot of the experience, the issues that I come across is when these women cannot even talk about it. So just to get the woman discuss about her FGM status and some of the issues she's experiencing, just speaking about it becomes a bit of a problem, and it requires a healthcare provider to be very patient and very tactical in terms of how they ask questions. And then also barriers such as the patient's attitudes and even misconceptions or myths about FGM will matter. So you find it's a bit challenging for healthcare providers, considering the amount of time they have with patients, that they would have maybe 10 to 15, even a maximum of 15, 20 minutes with a patient. So it's it's a short amount of time to discuss all the biopsychosocial dimensions that need to be discussed. But I think if there can be a simplified kind of checklist that healthcare providers can use to quickly go through all the systems that may be impacting the health of this woman with FGM, then that might also improve the provision of health care.
What would you include on a checklist like this?
What did I include? So as I said earlier, so issues of the biopsychosocial kind of issues. So looking at the simple biological problems that this woman might present in, which will be things like what kinds of diseases they are having. Are they living with, high blood pressure, diabetes, HIV, cancers, different kinds of injuries, or are they taking medications like family planning or other birth control kinds of pills, or for high blood pressure, for diabetes? And then